Hi YouTube, this is the IHF team. We are a medical scientist, an engineer, and a healthcare technologist. Welcome to our channel. The Immunohematology Framework, IHF, a universal operating model for the blood transfusion domain. This is the first video in a new series. Transfusion medicine, problems and solutions.
Blood banks strive to achieve two primary objectives: clinical efficacy and operational efficiency. Ensuring an optimal level of compatibility between blood donors and transfusion recipients is paramount, as is minimizing transfusion delays associated with complex or time-consuming donor selection. Moreover, the efficient spending of money is essential. Full care, from the blood bank to the patient's bed. Hi, this is Elena Butina. This presentation lists common problems and limitations in the transfusion medicine domain. It also briefly explains solutions included in the conceptual framework and implemented in the computer system. The problems include delayed transfusion, insufficient donor registry, deficient cryopreserved RBC inventory, recipient alloimmunization, the absence of quantitative assessment of immunogenicity and clinical significance of red blood cell antigens, and the lack of techniques to optimize RBC unit distribution. For each of these challenges, we have described the problem, identified the root causes, and defined the solution. Delayed transfusion is the first issue to discuss. The problem. There is a delay in obtaining compatible red blood cells for patients. This may delay an urgently needed transfusion, and in emergent situations raise the risk of incompatible transfusions. The root cause of this problem is transfusion planning that does not account for patient-specific characteristics. How does the IHF solution solve for this? By classifying patients by transfusion risk group, TRG, selecting donors early, and maintaining an efficient cryopreserved RBC inventory. It is worth mentioning that delayed transfusion is always associated with additional costs across the stages of care, from the blood bank to the patient's bed. Insufficient donor registry. The problem. It is difficult, if not impossible, to select a donor based on the extended phenotype of red blood cells. The root cause of this problem is the randomly performed extended phenotyping of blood donors. How does the IHF solution solve for this? By classifying donor RBC phenotypes. Extended typing is performed only on certain phenotype categories. Furthermore, extended phenotyping of donors that is performed randomly incurs costs that do not add value. The next issue to discuss is deficient cryopreserved RBC inventory. The problem. Long-term storage has many RBCs, but for some patients, a compatible unit is unavailable. What happens is the empirical stocking of long-term inventory with cryopreserved RBCs typically leads to the accumulation of RBCs whose phenotypes are widespread in the population. And this simply mirrors what is already available in refrigerated form. The root cause of this problem is the random or based only on ABO, RH, and KEL blood group systems cryopreservation. How does the IHF solution solve for this? By classifying donor phenotypes, only certain categories of RBCs are cryopreserved. What's more, cryopreservation is an expensive process. A deficient cryopreserved RBC pool results in a waste of resources. Now let's discuss patient alloimmunization. The problem. Recipient alloimmunization is associated with a risk of hemolytic transfusion reaction, HTR, or hemolytic disease of the fetus and newborn, HDFN. The root cause of this problem is that the current RBC selection practice poses significant challenges for the effective prevention of patient alloimmunization. IHF solution solves this problem by providing recipients with phenotype-matched RBCs, which effectively prevents alloimmunization. An interesting topic to discuss, the absence of quantitative assessment of immunogenicity and clinical significance of RBC antigens. The problem. It is difficult to choose the least immunologically dangerous RBC phenotype from incompatible ones. The root cause of this problem is that the characteristics of the recipient's blood do not allow the selection of a compatible donor, or there are no compatible red blood cells in the blood bank inventory. How does the IHF solution solve for this? Through classification of RBC antigens based on quantitative assessment of their immunogenicity and clinical significance, the system recommends the selection of the least dangerous RBC phenotype. Another interesting topic, the absence of techniques to optimize RBC unit distribution. The problem. It is practically impossible to optimize blood bank inventory distribution amongst recipients, especially if multiple requests have to be fulfilled at the same time. The root cause of this problem is that there is no method that can define and measure patient unit distribution criteria using scoring and ranking. How does the IHF solution solve for this? The IHF system employs a method that calculates a patient unit selection score and then determines a unit's rank against the entire blood bank inventory. We are convinced that a concise, accurate, and comprehensive approach to transfusion therapy implemented in a computer system effectively and efficiently addresses the problems and limitations discussed in this presentation. We hope that you found this video informative. Please subscribe to this channel and watch our other videos, which dive deeper into blood transfusion domain challenges and the IHF solutions that solve them.